Good day everyone, I am Andre, your science nurse for today. I am here to demonstrate and perform the assessment of the mouth and oropharynx. The first thing I need to do is I am going to assemble all my equipment and supplies. So I have here a pair of clean gloves, tongue depressor, 2x2 gauze, pen light, and of course alcohol for my hand hygiene. Next, I am going to introduce myself, verify my client's identity, explain to the client what am I going to do, why it's necessary, and how my client can cooperate. Good day, ma'am. I am Andre, your student nurse for the day. I am here to assess your mouth and oropharynx. But before that, ma'am, may I know your name, please?
I am Gia Ganara,
How about your age, please?
20 years old.
Thank you, ma'am. Ma'am, the assessment of the mouth and oropharynx is necessary to find out any variation from abnormal or any abnormalities in your mouth and oropharynx.
Okay.
And ma'am, please be cooperating with me during the assessment.
Okay.
Thank you, ma'am. Now I am going to perform my hand hygiene and observe for other infection control procedure. And of course, I am going to provide for my client's privacy by drawing the curtain and closing the doors in the room. And I am going to inquire for my client's history of the following. Ma'am, may I ask you some questions?
Yeah.
Ma'am, what are the, may I ask what is your dental care routine pattern? Ilang beses po kayo magsipilyo sa isang araw? Nag-brush po ba kayo pagkagising, after kumain, or bago matulog? And ilang beses po kayo nag-floss?
I brush my teeth 3 times a day, every after meal. I floss once.
Thank you, ma'am. Ma'am, how about, when's the last time you visit a dentist?
Last March.
Ma'am, how about any presence of ulcer or lesions, or parang nagkaroon niyo po ba kayo ng tonsils or sugat or laso po sa bibig?
Hindi pa.
Ma'am, how about any dental discomfort po? Nagpa-dentures na po ba kayo or nagpa-brace po ba kayo?
Hindi pa.
Thank you, ma'am. Ma'am, how about any medication po na tinitake niyo po?
Hindi. Wala.
Kasi ma'am, minsan po may mga gamot po na maaaring mag-cause po o magkaroon po ng laso yung taong nagtitake po nito.
Okay.
I am now going to do my hand hygiene again and wear my gloves for my client's safety. The first assessment that I am going to do is I am going to assess the lips and buccal mucosa. I am going to inspect for the inner lips, for color, for the symmetry of color, contour, and texture. For color, if it is pale or it is pinkish or pale or sometimes yellowish or black, black color of the lips, maaring yung taong may black na color ng lips is maaring naninigarilyo po siya or lack sa melanocytes. For the symmetry of contour naman, yung ability ng lips para ma-purse. And yung kanyang texture, it should be moist and smooth. Kung ang lips niya ay dry and rough, baka it may be an indication or sign of dehydration. I am going to use also a pen light for the inspection of the buccal mucosa and intention ducts. For the inner lips naman, I am going to assess the contour, or no, I am going to assess the texture, color, moist, and any presence of lesions. Ma'am, can you please open your mouth? Thank you, ma'am. I am now going to assess the client's teeth and gums. I am going to inspect for teeth and gums while examining the lips and buccal mucosa. For the For the gums, I am going to inspect the gums for color, bleeding, presence of edema, retraction, and presence of lesions. For that, if the client has a dentures or braces, I am going to ask the clients to remove the dentures or to remove all the dentures or partial dentures to inspect or to find out if there is the condition of the dentures or the condition of the gums na kung saan yung nakalagay ng mga dentures baka kasi maaaring yung taong gumagamit ng dentures yung gums niya is nagkaroon ng mga sugat o irritable pala siya o nagkalaso na like that. Ma'am, can you please open your mouth? I'm now going to examine your gums and teeth. Thank you, ma'am. I am now going to assess the client's tongue and floor of the mouth. To assess the client's tongue and floor of the mouth, for the tongue, I am going to assess the surface of the tongue for color, texture, mobility or position, and I am going to assess also the movement of the tongue. I am going to ask the client to produce her tongue and move it side by side. After that, I am also going to assess or inspect the client's floor of the mouth, base of the tongue, and frenulum. I am going to ask the client to produce her tongue and or roll her tongue up and move it side by side so that I can palpate the back of the tongue and the base and what do you call this one? Side of the tongue or the borders of the tongue. Ma'am, can you please open by the way, I am going to use a gauze in palpating and touching the client's tip of the tongue. Ma'am, can you please open your mouth wide and tilt your head a little bit back? A little bit back, ma'am. Thank you. Ma'am, now I am going to ask you to produce your tongue and move it side by side and roll it upward, just in case. Please produce your tongue. Move it side by side. Thank you, ma'am. Ma'am, I am now going to touch the tip of your tongue. May I touch it, ma'am?
Yes.
Okay, ma'am. Please produce your tongue. Now I am going to palpate the base of your tongue and the back of your tongue and the borders. Thank you, ma'am. Now I am going to assess the client's palates and uvula. I am going to assess the client's palates for color, texture, shape, and if there is any presence of bony prominences. By that, I am going to ask the client to roll her tongue up and let the client to feel if there is any presence of bony prominences. For the uvula, I am going to assess the color and texture. Ma'am, can you please open your mouth wide again and tilt your head a little bit back? And ma'am, for you to, para ma-arise po yung soft palate nyo, pwede sabihin nyo po yung, wait, ma'am. Say, Thank you, ma'am. Now, I am going to assess the client's oropharynx and tonsils. For the oropharynx, I am going to use a tongue depressor for me to able to expose one side of the oropharynx to avoid blood reflex. And for the tonsils, I am going to assess the size, discharge, and color of the tonsils. Ma'am, can you please open your mouth again and wide? And a little bit back. Tilt your head back. Thank you, ma'am. After that, we're going to document all our findings in the client's document records. Ma'am, upon checking and the result of your assessment, based po sa assessment nyo, wala pong any abnormalities na present po sa inyong mouth and oropharynx. Ma'am, thank you for the cooperation.